when a fracture happens, that complication is called as a compartment syndrome. Very, very important. Compartment syndrome question is frequently asked. Okay, so let us see what is called as a compartment first. Then we'll see what are the complications which happen when a compartment syndrome occurs. Let us consider this is the femur. I am making a cross section of the thigh. Okay, I am making cross section of the thigh. So this is the femur bone. What is the outermost structure? This is the skin. Yeah. Next to skin, what is the next structure which is next to skin? Can anyone tell me? Fascia. What fascia is there? One is superficial fascia, another one is deep fascia. Okay, very good. So this, what I'm drawing in blue color is deep fascia. Now this deep fascia, what it does is, it sends septors to the bone and it divides the entire region into compartments. This is one compartment, this is another compartment, this is another compartment. Okay, so in the thigh you got 3 compartments. So how the compartments are divided? So whenever the fascia goes and attaches to the bone, it divides the region into various compartments. So this is, each has got one. See, inside each compartment you will have a nerve, you will have an artery, and you will have a blood vein. Okay, so inside each compartment you will have a nerve, you will have an artery, and you will have a vein. Now suppose these muscles which are in the compartments, the muscles in the compartments doesn't receive adequate blood supply. So if the muscles in the compartment doesn't receive adequate blood supply, so decreased blood supply to the muscles causes ischemia of the muscles. Causes ischemia of the muscles. Whenever there is an ischemia, the muscle swells up. The muscle swells up. Now just can anyone tell me, when this muscle swells up, what happens now? What happens now? What is the structure which are running within the compartments? Nerves and blood vessels. Now this nerves and blood vessels will get compressed. This results in a syndrome called as compartment syndrome. Okay, so because of, see, whenever a fracture happens, the blood vessel can get compressed proximally. When the blood vessel gets compressed, blood supply decreases. Decreased blood supply is called as ischemia. When the muscle goes in for ischemia, it swells up. When it swells up, it compresses the capillaries, it compresses the blood vessels, it compresses the nerve within the compartment, resulting in a syndrome called as compartment syndrome. Okay, normally within a compartment, the pressure should be less than 30 millimeter of mercury. If the pressure increases more than 30 millimeter of mercury, then it is called as compartment syndrome. This is again an MCQ. When the pressure increases more than 30 millimeter of mercury, then that is called as a compartment syndrome. Now, what are the signs of compartment syndrome? Okay. First is pain out of proportion. Then there will be also pain over passive stretch. There will be pain over passive stretch. There will be pallor. Because of occlusion of blood vessels, there will be pallor. There will be pulselessness. And there will be paresthesia. And there will be paralysis. These are the 5 P's you have to note in compartment syndrome. And of this, the most important sign, this is again an MCQ, which is asked repeatedly. The most important sign in compartment syndrome is passive stretch. Is passive stretch. Just see here. Compartment syndromes are more common in forearm and it is more common in the leg. Okay, also keep this in mind. Compartment syndromes are more common in forearm and more common in the leg. If a compartment syndrome happens and if the flexor compartment goes in for compression, normally I flex my fingers like this. If I do opposite to this, stretch. So this is passive stretch. I will have severe pain in this region. So that is called as passive stretch. So that is the most important sign in a compartment syndrome. So in a compartment syndrome, you can have this 5 different entities. You can have pain out of proportion, which is pain is being increasing, and pain on passive stretch. The patient can present with failure, pulselessness, paresthesia, paralysis. But of this, the most consistent and important sign is pain on passive stretch. So keep this in mind. Okay, so these are the various complications you can encounter when a patient suffers from a fracture. So a patient can present with crush syndrome, a patient can present with fat embolism syndrome, a patient can present with deep vein thrombosis, a patient can even present with a compartment syndrome. These are various complications, and how you treat compartment syndrome, you release the compartment at the earliest. You do surgical release. You do surgical release by doing a surgery called as fasciotomy. By doing a surgery called as fasciotomy. That is, I simply cut this fascia. I simply cut this fascia. If compartment syndrome happens, that I'll identify the compartment and I'll release that compartment by doing fasciotomy. Clear? So fasciotomy is the surgery which is done to treat compartments. Okay. So with this, we have completed the general aspects of fracture. So when a fracture happens, I hope you now understand what are the different types of pattern, what are the different kinds of fracture, how you treat a fracture, and what are the complications when a fracture happens. Okay. Now you take crush syndrome. You know what is called as crush syndrome? See, whenever a trauma happens, whenever an accident happens, what happens to the muscles? The muscles gets crushed. Yeah. If your bone is getting fractured, means what is outside the bone? You got muscles. So the muscle gets crushed and then the bone breaks. So whenever a huge trauma happens, crush syndrome happens. So what does that mean? Whenever the muscles gets crushed, whenever the muscles get crushed, in the muscles there is a protein called myoglobin. What is this called as? Myoglobin. You know hemoglobin, illa? Okay, in a very similar way, there is one protein called as myoglobin, which is released into the circulation. This myoglobin can occlude the tubules in the kidney. It can occlude the tubules in the kidney, leading to acute tubular necrosis. Okay, so after a muscle getting damaged, the myoglobin which is released can occlude the tubules in the kidney, resulting in acute tubular necrosis. So there will be no urine output if an acute tubular necrosis happens. Clear? In another mechanism, when a muscle gets crushed, can anyone tell me what is the ion which is more inside the muscle? What is the electrolyte which is more inside the muscle? And what is the electrolyte which is more outside the muscle? Sodium is more outside the muscle. And what is inside the muscle? Potassium is more inside the muscle. So when a muscle gets crushed, potassium is released into the blood vessel. So there is an increased potassium in circulation, resulting in what? Hyperkalemia. Okay? Resulting in what? Hyperkalemia. So these are few other complications when a fracture happens. So whenever there is a polytrauma, whenever muscle crushing is too much, myoglobin release can cause acute tubular necrosis, potassium release can cause hyperkalemia and electrolyte abnormalities. Okay, clear? So this is one complication. There is another complication